Okay, another more complex case, an older patient, so the lesions are older. Yeah, maybe they developed when the teeth erupted, so 10 years before, because he had bad oral hygiene then. And then you do a re-wetting, and this is also something that is very important, because with the re-wetting, that means you put the ethanol or water on it, and you see how fast the appearance changes. And here you see there's still some whitish areas, so I was not happy. So I did some more etching. Here I used also pumice with the etching gel. You can mix that like a microabrasion just to be a little bit faster. So then I did another re-wetting, and now take a look at this area here. So this picture was taken 0 point in time, 1 second, 2 seconds, 3 seconds.
Oh, wow.
Yeah, you see, and within this period it is gone, and this is what you have to see. Then you can go for the infiltration. When you don't see this effect, do another etching. And then the infiltration, and you see immediately it will work. And you also may notice there has been a cavitation from the very beginning here. So there you need an extra filling on top. So there it was just some composite. And when it's just so small, we don't refresh it with a burr and make a phosphoric bonding and so on. We just place the composite on the icon. Yeah, when it's this size, when it's so small. Yeah, we use icon as a bonding, so to say. So again here before and after, so he was also very happy. And here you see again in one of the cases here, one of the teeth, this re-wetting, just to repeat it because it's so important. After etching, 1 second liquid, 2 second liquid, 3 second liquid. You see the change in 3 seconds? Then it remains stable, I think. Maybe from 3 to 4 there's again an effect. So it needs to be that fast. If you don't see this effect after 5 seconds, do another etching. What about fluorosis and MIH? So is pretty much the same as carious lesion, but of course it establishes the other way. So it's always there, the teeth erupts and you see it. Yeah? So it's not a demineralization. So there's a lot of amelogenin still in there, but fortunately it works. Here I will now show you some pictures of my dear friend Leandro Hilgard from Brasilia. He's a prosthodontic actually, and he has this medium or even mild case of fluorosis before etching, and then he did a re-wetting after once etching and a re-wetting after twice etching, the same tooth. And here you see very perfect the difference. He etched again because it was not good, and then after the second re-wetting it's good. And now he went to the next step, to the infiltration and polishing and so on. And after, so again here before, and the other side after. Yeah, so this is what you can expect with mild fluorosis. It always works quite well with twice or 3 times etching. And another case by Leandro, moderate fluorosis, and after the picture, so I put out, because of time, the pictures, and he has a picture here with a 16 months follow-up. So it's also stable. What about the long-term efficacy? We now have at least 12 cases over 6 years. We had a scientific paper here, as you see in Journal of Dentistry last year. And you see here that the 10 in the beginning dropped down to 3 overall after 6 years, and it remained stable. And then we had the lesions we etched only once, twice and 3 times. What about MIH? So I've shown you this case that worked quite fair, but we all know that there are big challenges, like these cases. Also again by Leandro a case here, whitish appearance, and one other thing that is new. So here are the lesions, and you can, with a light from the back, you can easily see them here and rubber them. So he etched only the parts that are whitish. Here he rubs a little bit just to have more etching, so the lesions are still there. Re-wetting, more etching. Actually he repeated the etching 2 times, so 3 times altogether. Re-wetting, and you see, better? Yeah. And here look at these nice pictures. So this is the re-wetting after once etching and the re-wetting after 3 times etching. So this is the effect you must have. Yeah?
Like after 3 seconds, it has to be completely gone.
Yeah,
that's what
right. That's what I said. Yeah, but here you can really see that you see that. Yeah, it's not something academical. Okay, then he infiltrated, and then another beautiful thing. Look, after 3 minutes, you have to put away your operation lamp. Very important. Otherwise, it gets hard. After 3 minutes, the lesion is still visible a little bit. Then he just waited for 20 minutes. Yeah, and rub a little bit and try to get the air out of the lesion. So this is the new trick, so to say. Many say that it's with this prolonged infiltration, it works very well.
Wow.
Okay.
Oh,
Yeah.
thinking you wait that one you waited for like 20 minutes?
Yeah, 20
Oh, okay.
minutes.
Instead of like,
Yeah.
usual 3.
Yeah.
Okay.
So I learned that just the last year, that it's really good, and we make now a study to prove that.
Okay.
Polishing, and then it's done.
Okay.
After, before, after.
Wow.
Yeah. So this helps a lot. And in the severe cases, yeah, here this is fluorosis plus MIH. There you infiltrated all. Then you drill away the bad parts on the MIH. Then you do the deep infiltration inside, like this. So you have no longer white spots inside, and then you place on top the fillings. What he did here, what is not good, you see he placed again the rubber dam not properly. Yeah, so be aware of your rubber dam. Yeah. But in the end, it looked good. Okay, so sum it up. Infiltration of aesthetically relevant white spot increases the refractive index. This is the effect, not color. Etching, 2 up to 10 minutes. Drying infiltration, 3 to 20 minutes. So this is not correct here. The re-wetting is very important. Fresh post-ortho case should be your first. Don't try a MIH first, try a
Easy
post-ortho.
one first, okay.
Also in fluorosis, you need more etching many times. And in MIH, you have to play around a little bit. And with this longer infiltration, it should work a little bit better. If it's cavitated, ICON serves as a bonding. You don't need extra steps. Okay, so let's have a look at the technique. So sealing is when you place a plastic fissure sealant on top of a lesion. Also for proximal areas, it can be done, but it's quite demanding, yeah, because you have to separate the teeth and wait and so on, so nobody's really doing it. But of course, you can think of. And infiltration means that you have the resin inside the lesion, as you know, and then you don't need a surplus material on top. And when the biofilm will inevitably establish again, the acids won't go through. Yeah? So like the sealant on top, infiltration inside of the enamel. And these were our first pictures in the lab when we found out that here this green resin could really infiltrate 70% of the lesion. It's again the 70%.
Wow.
So it's not 100%. Yeah, it's also important to know when we come to the aesthetic cases, because there you need some tricks to maybe increase the the flow of the infiltrate into the lesion. So what do you need? You need the erosion of the surface layer, longer times, 2 minutes, and a stronger acid, hydrochloric acid gel. Then you need to dry. The drying step is very, very important. And after drying, then you can use the infiltrant, as we call that, so the resin that can flow into the enamel parts of the lesion, and it's tactile based, but it takes a while. 3 minutes is the time. Here you see the infiltrant in red. Normally it's yellow, just that you see it better on the screen. So it's diffusing into the sugar cube, which is now placed as a caries. So it's an infiltrated caries, so to say. The sugar cube, and you have the infiltrated and the control on the other side with no infiltration. And we all know what happens to sugar cubes in liquids. They will dissolve, and
So
the
away.
infiltrated sugar cube is
Stays there.
still standing after 15 years maybe. I don't
Wow.
know. No, I'm kidding. We throw it away, of course. Yeah, but maybe it works along package. So the acid, the drying, and the infiltration, and the foil applicator. So this case here, you have a lesion that is maybe a little bit uncommon in the lower jaw. It's into the enamel for sure, but maybe already into dentin. So we decided to go for infiltration here. The patient had some orthodontic treatment before, so it looks a little bit that it has a retraction of recession of the gingiva. But here you can see the lesions very properly. Cleaning, then rubber dam, you see the lesion much better. Then you should detect with a probe, with a thin probe, if there's a cavitation or not. You can't see cavitations on X-rays. Although you think there is one, we made that in a bigger in vitro study, there is no cavitation. Yeah? In particular in deciduous teeth, you think, of that. And when you just use the probing, then you increase your sensitivity up to almost 90%. So use a probe to check if it's cavitated or not. Then the next step is the separation. Then you apply the acid. So here, just to treat one surface, you have this foil where it's two foils where the material is just coming out on the green side. So we want to treat the tooth 5 here. So it's only flowing here, and this one is not etched. And here the foil applicator is placed, the acid is coming out, you wait for 2 minutes like that, then you still in the 2 minutes, then you rinse it off. You can remove the foil applicator, the wedge should be in place, don't remove the wedge. Then comes the very important drying step, so really dry. That means 30 seconds permanent air blowing. Everything has to be really dry, and after it has been dried, then you take the ethanol and replace somehow the remaining water a little bit with it, and then when you dry again for 10 seconds, then it's more dry than with only the blowing. Yeah? So this is the whole process is 1 minute. Drying again, then you take another foil applicator with the infiltrant, and then you let it flow for 3 minutes. So here you see it's a little bit yellowish. Yeah? It has no real color, but a little bit yellowish. And you wait 3 minutes, then it's done. You remove it, you blow just the rest of the resin away in your suction, and you can use some floss, and then it's cleaned. It's much easier than cleaning a restoration, ceramic restoration, something like that. Then you light cure it. Then if you have some surplus, you use a scaler, you clean it, and then it's done. Then you need to control it, so you look if the lesion is progressing. So this control that has not been infiltrated, it progressed over 3 years. It's one of the teeth of the study we made. And in the test here, quite a big lesion here into the dentin already. It's stable after 3 years. So that's what you can do, monitor it. It's not radio opaque, we tried, but it's so hard because the X-rays are not so good most of the times. It's not such a big problem when you stay with your dentist. Of course, when you change the dentist, you have to tell the next one, I am infiltrated. And for this purpose, you have the booklet to say as a patient, I am infiltrated. Studies, there are many out, and just to compare it maybe to a filling, this is the largest study I know about composite fillings, 224,000 restorations in private practices in the Netherlands, in Europe. And you see these private practitioners have an annual failure rate of 5%. If you make a university study, maybe you have a failure rate of 1.5. And altogether for the infiltration technique, we have like 15 studies, and they show an annual failure rate of 2%. So maybe it's a little bit worse than a high-class university filling, but this is not the right comparison. Yeah? When this here has failed the infiltrant, you start again with the filling at 100%. Yeah? So you have nothing lost. Yeah? That's very important.
지금까지 말씀 감사드립니다. 강의에 대한 내용을 제가 들은 소감을 좀 말씀을 드리자면, 지금 이전에 오셨던 분은 이 전치부의 그 화이트 스팟을 지우는 그런 강의를 해주셨는데, 일단은 인전면 충치 치료를 치료하기 위한 목적으로 이 제품이 개발됐다는 점이 되게 흥미로웠고요. 저도 지금 뭐 이렇게 환자들한테 얘기를 할 때는 인전면 충치가 작게 있으면 좀 우리 관리를 좀 열심히 해봅시다, 관심을 가져봅시다 정도로 얘기를 하고 계속 관리를 하다 보면 언젠간 또 충치가 되더라고요. 근데 이제 인필트레이션을 해서 진행을 막을 수 있다면 이걸 좀 열심히 써봐야 되겠다 앞으로는, 이런 생각이 들었습니다. 지금까지 말씀하셨던 내용들에 대해서 궁금한 게 굉장히 많은데요. 일단 저희가 준비한 질문을 좀 해볼까요?
Okay, so I mean, as you said, you learned about drilling and filling all your life, right? What made you invent this new product?
I think first it was the own experience of having too much drilling and filling in my mouth.
Okay.
And also in the mouth of the patients. But then it was just that it was also my dear friend Sebastian Paris who did it together with me, that we were thinking about doing something else than just placing a sealant in the proximal area. So others had done this, the sealant of proximal surfaces, and we thought, why not get it in? Yeah. And then we tried in the lab with chemicals and so on, and in the end it worked.
So how long did it take you to the whole process? I mean, the process itself, like 4 or 5 years?
Yeah, maybe the whole from the very, very first start until it was a product, maybe it was like 5 years.
Once you do the hydrochloric acid etching and wetting, and then when you put the infiltration on top of it, you wait it for like 10 to 20 minutes in some cases, right? That really helps in can you explain the mechanism behind that?
Yeah, it's something that I learned from others actually. Then I just tried it once or twice so far because it's very new information. But I think what happens is that you can get the air a little bit better out. You cannot push the infiltrant in. That's not. But maybe just by going over it again and again with your brush, the air is more easily coming out, or it's going by itself a little bit deeper. Yeah.
Just like capillary action, maybe doing a little swirling on top of with some brush.
Yeah.
It may do, you know. Yeah. Okay. So that's the
That
reason
would
you
be
wait
the
for.
explanation.
Okay. So I mean, you know, by looking at the, you know, the cases you have shown me, I was amazed by how amazing that is. In Korea, right? Us doctors, we actually want our kids to become a dentist as well. You
Are you
know?
sure
Is it?
about
Is
that?
I do. So I mean, you know, even though they don't want to, but that's what you know. I asked them, "Do you really want to be a dentist or whatever?" I'm thinking about it, but I mean, you know, they're kind of reluctant at this moment. But in your country or in Switzerland, is it the same, or do you recommend your kids to become as same profession?
Actually, I think 1/3 to almost half of the students have dental parents.
Oh, really? So,
I think it's like that. And I think it's a very good job. So my oldest daughter already said she wants to become an
great.
orthodontist. And you know why? Because they earn so much money, so she can go to the wonderful mountains 4 times a week and work on 3 times.
and maybe after she does all the, you know, braces, and then she can send it to you,
Yeah.
to the infiltration afterwards.
I hope she takes the braces off when the children develop.
Exactly.
한국에 오셔서 좋은 시간을 만들어줘서 감사드리고요. 네, 뭐 이제 시작하시는 두 분들이 앞으로 잘 출발할 수 있게 제가 도와드릴 수 있어서 영광이었습니다.
일단 조금 더 재밌길 원했는데 오늘은 굉장히 학구적인 것 같아서 조금 아쉽고요. 다음번에는 조금 더 즐겁고 학구적인 주제로 찾아볼 수 있으면 더 좋을 것 같긴 해요.
저는 많이 써보지 않은 재료이기 때문에
네.
오르트하는 케이스에서만 좀 해봤는데 더 많이 써야 될 것 같고 이게 정말 패러다임을 바꿀 수 있는 계기가 되지 않을까 생각 좀 기대가 됩니다.
Yeah, thank you very much. And, have a
to
nice
Korea.
day and have a good infiltration.
Okay. Try a lot of Korean foods here. Okay.
Yes.
All right.
감사합니다.